I am so excited for this episode today. I invited Sara to come on. We had to reschedule a couple of times. I think it was mostly my fault, but I have my mom here now. I have Kaya. Guys, the sandwich generation business, no, I heard about it, but for some reason I didn't think it would be me. It's funny, my mom living with me right now, it's like I never had the best relationship with her. So it's a little bit ironic. Is the word ironic just weird? Just like feel like I'm battling some of my own demons, but I do have such love for her and I want her to be okay. So those assisted living homes, no, you guys know. I couldn't. The one I went to anyways, was just too many red flags. I couldn't sleep that night. I had to get her out. Look, I may not have had the best relationship with her, but the last thing I want is anything bad happening to her. And hopefully with her being here, I can keep an eye out, do my own assessments as a nurse. That's what I do, right? And hopefully get her a little better. Maybe get her own place. I don't know. We'll see. But anyways, thank you to Sara for obliging me and rescheduling a few times. But it was worth it. Let's get into it. Today, we are going to talk about not just like what we can do if we get diagnosed with gestational diabetes, but why. You guys know I am all about the why. Why do we care? Is it a big deal to have diabetes? It's a kind of a scary word, right? You're going to Google it. You're going to find out some information. You're going to go to these hospital websites and maybe you read some studies. Fantastic. But until you actually maybe hear it from labor and delivery nurses from our mouths, it's a whole different, and it's a conversation that we're going to have. It's a whole different kind of ballgame mindset. And hopefully it helps for you to understand. Because when you understand why you care, it will hopefully alleviate some of the anxiety or fear behind it. You're going to understand why we have to check your baby's blood sugars. Do you know how many times I have GDM moms? And GDM, by the way, is how we shorten gestational diabetes. DM, diabetes mellitus. Mellitus? Is that how you say it? Mellitus? Mellitus? So that's how G, gestational diabetes mellitus. GDM. So that's how I'm going to say it. But we have these moms coming in with GDM and I tell them I have to check the baby's blood sugar and they're like, yeah, okay. And I said, do you know why we're checking? No, they don't. You don't know why. Why do you care if your baby's blood sugar is low? You know, baby's blood sugar being low is probably not a good thing, but how does it affect your baby? So listen all the way through. We talk about that at the end with the babies and why we check it and what we're looking for so that you can have an eye out too, especially when you go home. We talk about, okay, you got diagnosed, but your blood sugars are always good. So is the diagnosis wrong or should you still care? We get into it. So you don't want to miss this. I'm so glad you're here. Let's listen. Oh, and let me just preset this with Sara. She is a high-risk OB. She's been one for 2 years, an L&D nurse for over 6 years. Bravo. She's right there with me. And now she works in an MFM office, right? So she works with doctors who are specifically there to look for baby's anatomy. The MFN is who you're going to see at your 20-week appointment, and they're going to do an ultrasound, and they are specialists on newborns. No, specialists on pre-newborn. Oh my gosh. She told me to edit the one word she got wrong, and I'm like, girl, I would be here all day if I had to edit all the words I get wrong. But yeah, she works at the MFM office, which is really cool. I didn't know that. And more importantly, you can find her at Gestational Diabetes Nurse on Instagram and sign up for her membership. If you have been diagnosed with diabetes, you don't want to miss out on that and get that support from a nurse that knows what she's talking about. Because I'm telling you, even the nurses in the hospital, we may not know. I get into my story. We may not know everything. Your doctors, the nurses at your doctor's office, you may not have all the time in the world to sit down with your doctor. So are you really going to get all your information from just Google and overwhelm yourself with unnecessary stuff? Or do you want information that's you can trust, that's coming from someone that has spent all the time researching and learning, and she has life experience with it? I would. So go find her at Gestational Diabetes Nurse. Anyways, here's Sara. Welcome to the Birthling Podcast, presented by My Friend's a Nurse. I'm your host, Colette McCullicher, a high-risk labor and delivery nurse right here in sunny California. I'm also an OB certified specialist, birth educator, lactation expert, and mother of 2 beautiful daughters. I am passionate about guiding you through the miraculous journey of pregnancy and childbirth, using evidence and history and asking the reason why. I have some incredible medical friends and colleagues, and we're all here to help you navigate this often overwhelming birthing hospital system in the United States. My goal is to gain trust in birth, improve this system, and provide some valuable insights. Let's make this journey a little less daunting and a lot more joyful. Let's get into it. All right, Sara. So we have already got started talking. So I just went ahead and pushed record. So you can tell me where you started working. You take it away. Go on.
Thank you. So I've been a nurse for over, 7 years actually. My anniversary is in March when I took my NCLEX.
Say,
So
well, I'm
yay.
8. I just like finishing 8, but
Oh,
close.
awesome. Yeah. So yeah, I just took my NCLEX March 5th. I'll never forget, which is so amazing. It's really been a privilege because my entire career has been with maternity, labor and delivery, for the most part, labor and delivery. And as I was saying before, I worked in 2 different organizations so far. And the first hospital that I worked at, I'm in New York City. So the first hospital that I worked at was a smaller hospital, and the clientele that we served were more patients that were, immigrants, people coming off the plane from JFK, traveling for months and months to, across the country to get to us. I didn't know we were well known, but yes,
months and
I'm
months.
kidding. Yeah, I had a patient one time like that. It was a crazy story. She had this whole travel experience that she had to get to New York, right? So in this hospital that I worked at, I loved labor and delivery. It was such a exciting role to help mothers with this beautiful moment that they're going to have with their baby, right? It's a life-changing event, and it's honestly the nicest part of the hospital in my opinion.
I always say we
But
get to work with moms when they're at their most vulnerable, but they're most like the
yeah,
strongest they'll ever be. And like what a powerful place to be.
yeah.
And then when they don't have that strength or they can't find it, we get to be the ones to hold their hands
Mhm.
and be strong for them until they come back, right? So
Yeah,
powerful.
100%. Yeah, so I loved it, but I noticed right away the lack of education that these women had only because of their socioeconomic status and their lack for prenatal care, their lack for healthy foods, their lack for shelter, even sometimes. I mean, we really had a lot of cases, and I've seen firsthand how that affected mothers who had gestational diabetes and even type 1 or type 2 diabetes, and that really impacted their babies' health outcomes and their own health outcomes. And you asked me about shoulder dystocia and the complications of gestational diabetes or type 1 or type 2. It's really a lot of these moms had no idea. I will never forget one patient that we had. She was maybe 18, 19. She came in, and the nurse, I didn't have her, another nurse took care of her, and she did her finger stick, and it was 300, something crazy. And she was like, what's going on, what did you eat, whatever. And this girl hasn't been taking her insulin, this mother. And we really had to have that conversation with her as we were putting in IVs and all these things to stabilize her and her baby and sending her to the ICU. And it was just a very, very traumatic experience for both her and as a nurse, and to see the impacts on babies like that. Now, not everyone has that. Obviously, thank God we have healthcare. Thank God we have access to care. And I'm grateful that I moved on to my other job, which I currently work for another organization that primarily that population is more educated and they do receive more prenatal care, and most of the mothers are well aware of gestational diabetes. But again, there are still risks if there are a lot of mothers who don't have that education or that support to really manage their blood sugars, and things can happen to their babies. It can cause shoulder dystocia, meaning the shoulders get stuck, the baby's head comes out of the vagina, to be very graphic, but the shoulders get stuck, and that's an emergency. And you'll see a bunch of people running into the room trying to safely deliver this baby, and it can cause
So
damage to
what
the
they always,
baby,
I'm
whether
going
it's
to
nerve.
interrupt now that you mentioned shoulder dystocia.
Yeah,
Let's talk a little bit about that. Because what I
yeah,
really want to talk to you about
yeah,
today is exactly what you have already started talking about is the why are we concerned with diabetes?
yeah.
Because
Why?
diabetes has this, it's a scary word to like, oh my God, I have diabetes. Or
Mhm,
it's always like, well, someone else has diabetes, someone older, someone,
mhm.
that's doesn't take care of
I'm healthy,
themselves,
I'm
but it could
young,
be
yeah,
anybody, right?
yeah,
And then there's kind of a mystery behind it too. Like, well, my blood sugars are okay. How come I have diabetes? And maybe I don't need to worry about it. And all of this mystery surrounding it, right? But I really
yeah,
wanted to discuss today because we do hear other places. I have heard you on other podcasts and IG lives, and I loved it. And you discuss a lot about what to do to manage it, right? Testing and
yeah,
how can you
yeah,
manage it to make sure you eat well and keep a healthy lifestyle and make sure you're regulating your blood sugar and even if you need insulin and whatnot. But why, right? I'm big on asking
yeah,
why. Why do we care? Is
yeah,
this really going to affect us in the end? And so now
yeah,
we're going to get to the nitty gritty of, as you and I are both labor and delivery nurses, we know better than anyone why, right? So, okay, so you started with
mhm,
shoulder dystocia. So, okay, tell me if I'm
yeah,
wrong, because I didn't even look this up, but when I was being trained and as I was being taught,
mhm,
with diabetes, especially with gestational diabetes, the babies,
mhm,
they're not only coming larger, but the
mhm.
amount of fat in their chest is more than even,
Their
yeah,
abdomen.
and their chest too. So which is why the shoulders, which can usually squeeze around the babies when they're coming through the pelvic canal and through the vaginal opening, their shoulders are meant to get under the pelvic bone by squeezing together. Imagine squeezing your boobs together, right? But they can't with your
Right,
shoulders. But you
right,
can't do that if you got a big chest, right? So
right,
that
right,
more than anything puts them at a higher risk of not being able to bring their shoulder down and under the pelvic bone, which is
mhm,
why it's
mhm.
a larger increase of shoulder dystocia, why you're going to be higher risk, why we're
Right,
going to have a stool handy so I can climb up and, and help the doctor
right.
if need be, right?
Or even a C-section,
So yeah, so many
because
doctors, it takes one or two bad cases for them to be like, yeah, I'm not
yep,
doing that anymore. You're going to have a C-section. And then it'll be up to the mom and the partner and to do their own education and maybe find a different provider that isn't going to base it on fear. Or maybe it's what they want, right? They're like, yeah, I don't want a shoulder dystocia
right,
either. I'd rather, you
right.
know, C-section sounds fine to me. Let's just do that. So it's definitely, I always,
Mhm.
it's up to the patient, but it has,
Right,
she's
right, as long as they get educated on their options. But again, before the shoulder dystocia, we can help you manage your blood sugar so the baby does not have that outcome, and you can safely have a beautiful, positive vaginal delivery if that's what you would
right. They're
like.
gonna they're gonna monitor baby's
Un
size and baby's growth, baby's abdomen size and
Mhm,
chest even. And
mhm,
that will kind of help you decide where you are on that risk factor or risk
right,
scale, and then it's still your choice. A lot of doctors will lead with big baby or whatnot, and so you really have to do the due diligence, maybe find what positions can be best to deliver with a higher risk of a bigger baby, right? So maybe you want to
right,
deliver
right,
on all fours like the Gaskin or whatnot, because you could be a higher risk with a bigger baby. And
yeah, and also when sugars are not controlled, the baby's fluid might be high. So that's also a risk factor that can potentially be, it's not the worst thing. I mean, there's people walking around that have high fluid and we'll never know because they never had a sono in that particular time. But it is a risk factor because if you were to break your water, it could cause a complication that's a little bit more rare. It's called a cord prolapse. And a lot of doctors don't feel comfortable with having you continue your pregnancy if the baby's fluid is high, especially if you have gestational diabetes. That means that your sugars are not well controlled, and that's a whole different ballpark. But in general, so we look at that too, especially when you were talking about the growth. We measure the baby's abdomen, like you said, and the baby's fluid as well.
Exactly. Yeah. And then
Yeah.
not only that, let's get into, we have shoulder dystocia, we have polyhydramnios is what you were talking about when you have a lot of
Yes.
fluid inside, which is not alone, standing alone, we're not too concerned with a lot of fluid. It's, you're going to be
Right.
managed the
It's
same.
something to keep an
Yeah, it's just
eye
some, it's going to
on.
be, you're going to get your bed
Yeah.
sheets probably really, really wet if your water
Yeah.
breaks. And we just
Yeah.
want to manage
And
maybe kick
usually,
counts, making sure babies, that cord is not prolapsed. And usually if baby's well engaged and ready to go, you have no problem with that. But yeah, something to be concerned about. No. Then, how does gestational diabetes? I've heard that it can affect or maybe make you higher risk for preeclampsia, hypertension, like
yeah.
other things will fall
Yeah.
in line,
Yeah.
right?
I love that question because we actually, so currently I work in maternal fetal medicine. I'm actually a contract nurse, so I've had the privilege to work in different maternal fetal medicine offices in New York City, which is amazing because I get to
Really? That's
see,
so cool.
yeah, I get to see the back end of what I've seen in labor and delivery. Like, what does
Whoa,
it
that's
mean?
awesome.
Yeah, what does it mean the patient has poly? And I actually am certified in doing BPPs, which are ultrasounds. So I can actually measure it myself, which is awesome. So it just helps me piece those two puzzles together for
So
me
when
and
you
my
say you're having
patients.
a rough day, you're talking about there when you're working at the I'm
Yeah.
thinking you're L&D. I'm like, girl, I know what you're talking about. Okay, in fact, I do not.
Well, I mean, a nurse is a nurse, you know. At the end of the day, everything falls on the nurse's responsibility, not the medical assistant and not the doctor ultimately. But what I was referring to, yeah, what I was referring to was basically in maternal fetal medicine, we learned, I was taught, actually, let me rephrase that. I was taught that because your blood sugars are not managed, it can actually cause IUGR, which is intrauterine fetal restriction, which is very interesting. So they found that if you have diabetes, gestational diabetes, I'm sorry, you're higher risk for having preeclampsia, and preeclampsia is associated with a smaller baby because the placenta is not perfusing to the baby adequately, so the baby's smaller and the placenta is not working as well as we would like. And we also check in the ultrasounds, a fancy term is called a Doppler. So we make sure the baby's umbilical blood flow is normal, which is very, very interesting. So I did not know that
I
when
didn't
I
know
was a
that
labor and
either.
delivery
So you
nurse.
can have a big baby or you can have a
Yeah,
small baby. Yeah, it's really going to
yeah,
just generally
it's true.
affect the baby's growth in one way or another. If your
Yeah.
blood sugars are
But
not
again,
managed. Have you seen that happen
exactly.
very often when the sugars
I
are
was
not
going to say,
managed?
yeah, so I was gonna say it's really depending on your blood sugars because if your blood sugars are managed well, then you don't necessarily have a higher risk. It's just one of the risk factors. But some people just have small babies and they have gestational diabetes. So that's it's
Right,
kind of like which
right,
which
right.
came first, the chicken or the egg. But they have seen a higher risk factor for preeclampsia with gestational diabetes because the placenta is not functioning as normal. So that's I think that's what is related to the preeclampsia aspect as well, in
So
simple terms.
interesting. And then,
Yes, it's
yeah,
very
and
interesting.
it could also lead maybe to increase in postpartum depression. Maybe it's
Hmm.
just from having to check your sugars all the time, maybe having a feeling of that your body wasn't working properly, or it could actually be a placenta hormonal issue, but they found
Yeah,
that
I'm sure.
women with gestational diabetes had a higher incidence of postpartum depression too. Just
Of
yeah,
course. Women in general have a higher, after
yeah,
having a baby,
we have
but
a higher
it's
incidence of
if
giving
you
birth.
don't have yeah, but if you don't have support when you have gestational diabetes, you definitely will have birth trauma and pregnancy trauma. I mean, that's why I started doing what I'm doing because I don't feel like we give these mamas enough time in MFM or even doctor's offices,
Not at
honestly.
all.
Like a lot of patients, yeah, a lot of patients have told me, I didn't even know I had gestational diabetes. They sent the referral and somebody called them from MFM saying, we're putting enrolling you into a class for gestational diabetes. And the patient said, wait, what? I have gestational diabetes. And
That's
then other patients
crazy.
told me, oh, yeah, and it's not one time. It's been a couple of times like that. And other patients told me the day they got their diagnosis, their doctor gave them their insulin prescription. And I just find that so horrific because we are setting these women up for failure. We are not educating them enough because we have too many patients. Our facility is providing care for over 200 women who have gestational diabetes every
Or
month.
get this, get
Imagine
this.
that.
I was at a small hospital too, and we would admit a mom overnight. She'd have to come in, have her be monitored, and then they would send me in year one. Okay, Colette, go do her diabetic teaching. I'm like, I'm sorry, what?
Yeah,
What do I know?
yeah,
Nobody has taught me from the book I read, the chapter I read in nursing school. No one taught
yeah.
me anything. And they wanted me to show her how to use her glucometer and insulin. Like,
Mm-hmm.
what? I had no idea what I was doing. And they were sitting me
Let
in there to
me,
do it. I was Googling, asking
yeah,
other nurses real quick before I went in, what am I supposed to teach her? And we
yeah,
just printed it out and I highlighted and read. I had to go on my own and do my own
yeah.
studies and research so I didn't feel like that again. We're not equipping nurses either.
Yeah, and let me top you on that. In my first job, how it worked was I was doing labor and delivery antepartum, which is high risk pregnant women that got admitted for observation or whatever, and postpartum and nursery. So I was a jack of all trades. And I remember there was a patient that was admitted in antepartum. Her blood sugars were high, so she needed to be started on insulin. And I had to go and teach her, like you said. And guess what? She didn't speak English. So, on top of everything, I had to get the translator, and
I
I
would
had no
die.
idea. Yeah, I was literally a brand new nurse. I had no idea. I was scared to give insulin myself
Right.
back then because I didn't have experience with it. And I felt like, oh my gosh, how am I going to teach this mother who doesn't speak English, who has very limited support at home and lacked prenatal care? How was I supposed to teach her everything she needs to know in that 15 minutes that I had before I had to run off to another patient? And it was just really,
It's
really
sad. Yeah.
shocking that,
I didn't know how to use
yeah, and
her
I felt
insulin
uncomfortable.
syringe and these ones that I'm used to the ones we have at
Yeah,
the
yeah.
hospital when we give
That's the
another,
hospital
okay,
when you
teach her how
draw
to
it
use
up.
it. I'm
Yeah,
like, I I just went in. I'm like, all right. I pulled out the instructions. I'm like, we're gonna learn this together.
yeah,
And I just reviewed the instructions with her and then
yeah.
let her I did it and then she tried and we did together and we're like, yeah, that feels right. That feels right. It worked. It worked. She felt very empowered because she was almost helping me. So it
I
was
love
fine,
that.
but
Yeah,
but
and
not fine. That's
it's
not what
sad
we
because
expect out of our
right.
nurses. And
And it's sad because in these doctors' offices, that's what the staff nurses are doing. They are not certified in diabetes education. They're just going off on what they heard from nursing school, the printouts that the old printouts from the
yeah,
80s say. And it's funny because I started working at this major center, maternal fetal center, at this big organization, and have this huge team of diabetic educators that services these moms that I was telling you about from different doctors' offices. And these were certified diabetic educators that were nutritionists. So that's how I learned about this role. And they taught me so much. And now I work at a different maternal fetal medicine office. And I'm like, the nurses are just reading off the handouts. And
Literally, yeah.
because of my experience, yeah, because of my experience, I'm able to direct the patients and say, you should really be eating a bedtime snack. And here's what you should be doing if you want to eat rice, because our patients are from
Yeah.
different ethnicities, right? So here's how you want to pair your rice to manage your blood sugars. So I really feel privileged that I had that experience because, like you said, so many nurses and so many doctors are not spending they're not spending the time and giving the right education to these moms. And that's why I brought it to the online space, because I want to provide that, because I've seen it firsthand in maternal fetal medicine and in labor and delivery, how these moms are just not supported. They are clueless about their diagnosis. And when the baby's sugars are low, they're freaking out because why didn't someone tell me about all this,
Yeah. And even
And
when they stayed at the hospital overnight and all of that, and we we learned together, they would have the nutritionist, but it was the hospital staff nutritionist.
yeah,
She has to have so much information about so many different kinds of diets that it's
yeah.
for her to come in. She probably came in twice a month to speak to them about specifically gestational diabetes and that diet, diabetic. And then even the cafeteria, they're just sitting at diabetic. It's very umbrella,
Mhm.
just one size fits all for everyone. So it's so
Mhm.
cool and
Mhm.
so great that you are not only specialized in gestation diabetes, well, yes, but that you are specialized and that is it. But, but you're also a labor and delivery nurse that you have seen
Mhm.
what it means to when you don't, when you're not following and you have uncontrolled sugars and all of this. So I think that's so cool. It's so cool.
Yeah,
And you're available to
and
everybody. So
yeah.
that's amazing.
Thank you. And I think what you're doing is
I
so
think we
cool
have the
too.
same,
You're
yeah,
being
that we
empowered.
saw such a lack
Yeah.
of education and support for women once we got to the bedside,
Mhm.
and it wasn't enough. We had to do
Yeah.
more, right? We had to get out there and do more.
Yeah.
And I'm the same. I'm trying to start this home health business so that I can go to those houses and do this gestational diabetic teaching that I had to learn on my own.
That's
But now,
amazing.
I want to get certified, or I want to hire nurses just like you that can go and sit down and find out, look in their cabinets, have a discussion, really talk about it. And so that
Mhm.
they feel super supported, because the doctors need some help and MFNs need some help, right? The hospitals, they need some help, and nurses are the way. Why are
Yeah.
we only at the bedside those 2-3 days that they're in labor, right?
Right. Right. Prenatal education is so
Yep.
important. And honestly, you can have a healthy pregnancy. It's not going to be so complicated where you have to change your entire lifestyle. You can still, I mean, you do have to tweak some things here and there, but this is really for your future and for your baby's future and for your future, toddlers and your husband's future or your partner's future. This is really whatever we're teaching these moms now, I feel are so beneficial for every aspect of their life. And I always tell them, please continue what we're teaching you, whether it's to pair your foods, whether it's to meal prep, whether it's, to be active, to exercise. These are all beneficial for the rest of your life and to prevent type 2 diabetes for you later on in life as well, and for the rest of your family.
Let's get back to the risk of future
Yeah.
diabetes. Is that the
Yeah.
precursor? So if you get gestational diabetes, I have heard that you're a higher risk then
Yeah.
to get diabetes later in life. Is that true?
Yes. Yes, it is true. There's a lot of evidence on that. There's also evidence that the if you have a bigger baby, if you have a 10-pound baby, you are also at a higher risk for having gestational diabetes, which is very
Wow.
interesting. Even if you didn't have it, yeah. Even if you didn't have it, it's very interesting because it's
Was
probably
missed.
something, yeah, it's something that it might have been missed, but also you want to make sure that if that's your case, if you had gestational diabetes, you can kind of reverse it. It might be remain, what's the word I'm looking for?
Like an
Like
underlying risk or Yeah, it's
Yeah.
still haunting you a little bit, but you can close the door. So,
Remission. Yeah.
okay, so we talked about the risk, right, of for mom, shoulder dystocia, IUGR, or a big baby, right? We have the risk of preeclampsia, hypertension, even postpartum
Mhm.
depression,
Mhm. Mhm.
C-section. You have a higher chance of C-section,
Mhm.
you mentioned. You have a higher
Yep.
chance of preterm labor, or, of course,
Yes.
being induced early, especially if they're out of control,
Mhm.
and stillbirth. Let's not forget, because
Yes. Let's
I've seen
not
it
forget
happen.
that.
I've seen a mom
Yeah.
come in with a
Me
sugar of
too. Me
500
too.
and the baby was 38 weeks, beautiful baby,
Mhm.
but did not survive that.
Mhm.
You have to keep them under control. And it's so, so heartbreaking. So that's very rare. But if your
Yeah.
sugars are not under control,
Yeah.
you can go in, diabetic ketoacidosis, and
Mhm.
you put your own life at risk as well. I had a question on the tip of my tongue before I went over the risks again. Oh, yeah, I have a question for you. And if you don't know, that's fine, but I feel like you're the one to ask. Okay, so you're getting diagnosed. You went through the two funnels, right? You got your 1 hour check, you failed. Bleh,
Mhm.
I failed mine. That's okay.
Mhm.
It's okay. It's just a funnel, right?
It's
It's a
okay.
filtering
It doesn't
system.
mean anything.
Then you fail
Mhm.
your 3 hour glucose test, right? You're like, oh,
Mhm.
shoot.
Yeah.
Now
Yeah.
you are diagnosed with gestational
Diagnosed.
diabetes. But you check your blood
Mhm.
sugars and they're always fine.
And they're normal.
Can you answer why is that?
I love that
Do you get that
question.
a lot?
Yeah, I actually do. I remember I had a patient recently who was diet control and she was like, I don't think I have
I had a
gestational
client too
diabetes.
say the same thing. And I'm just like, girl, I don't know.
Yeah, she's
Are we
she's
overdiagnosing?
like,
What's going
I
on here?
literally so she said she's literally eating whatever, and if she eats really, really, really bad, then it's high.
Right.
So I told her that it's possible that the threshold, the test is not 100%. Nothing in life is 100%. But because we give you that overload of sugar, it triggers something that gives a response that raises your blood sugar. So why is that? That's something to be
And it's
investigated.
50 grams,
And
right?
B,
It's 50.
so yeah, so that's for the
Yeah.
2 hour, yeah. I think for the 3 hour,
It's 100.
I'm not if I'm not mistaken, it might be, yeah, it might be a
Woo!
little bit more. I always get
Like
mixed
two
up.
Snicker bars. Maybe I just eat two Snicker
Yeah, it's
bars.
so
Like,
funny.
come on. No, specially formulated
You can do the
guys,
French
don't
test.
go eat two Snicker bars.
Yeah. But for this 3 hour test, so they're testing you 4 times. They're checking your blood sugar 4 times. And if two of the blood sugar levels are high, that's when they diagnose you with gestational diabetes. So it's really looking at a bigger picture. So, I mean, again, that it's not never going to be 100%, but for the people who have they're diagnosed with gestational diabetes, but their blood sugars have always been fine, it might be that it's something that later on in life with another pregnancy, they might have higher blood sugars. It's just something that is in them that is triggering that high blood
So
sugar when
weird.
they take the test.
Yeah.
Yeah, and honestly, that's why we do the growth and the testing to make sure that, on paper, your blood sugars may be normal, but is the fluid high? I've had patients who had that. Their blood sugars are perfect on paper, but their fluid is high. So that's
Other
like,
stuff going on.
maybe, yeah, maybe her blood sugar spikes 3 hours later. Maybe her snacks are spiking her. You're not supposed to take your blood sugar after snacks. There's something going on there. And sometimes it's just
It's a
bigger.
bigger picture.
That
Those
if you're
blood
gonna have a
sugars
bigger
that
baby.
are quote unquote normal in range when you're,
Mhm.
especially when you're diet controlled, it's a snapshot. It's simply a shot, like
Yeah.
any blood test, like anything. It's just a snapshot to give us data
Yeah.
to work with. It's not the full picture. So we
Mhm.
also have to see all the other
Exactly.
factors like baby's growth, how much fluid you have in your body, what are your blood pressures, are you have a lot more
Mhm.
swelling in your ankles, are you collecting more, are you retaining more fluid, that kind of thing. There's a lot of other factors we're looking at. If everything else is normal,
Mhm.
then continue on, girl. Have your healthy
Yeah.
pregnancy. And but it goes
Yeah.
with everything. You really, during pregnancies for my clients, I'm definitely leaning in and teaching them how to listen to their body and respond to that more than anything,
Mhm.
and use your sugar levels,
Mhm.
use the blood tests as a point of data. That's it. It's not, you're going to
Mhm.
see one blood sugar and it's okay and be like, I'm fine. Right? There's so many other things that
Right.
we need to look at. For baby, we can talk. I
100%.
want to talk before we end. I literally could chat for hours with you, but
I know.
so we talked about for baby macrosomia is when baby's too big, IUGR, or small baby, preterm birth. Let's
Mhm.
talk, because you and I, right after birth, we have to check baby's
Mhm.
blood sugars, right? What happens when
Yes.
they're low, and why do we care? What is the fact? What are we
I
looking at baby too?
Yeah,
Not just the blood sugars, but what if they're shivering
jittery,
or
shaky.
totally just laying there, not
Mhm.
active? What are we looking for and why?
Mhm.
Let's talk about that.
Mhm. I love that question. So, like I said, at my first job, I was exposed to very high risk women, and I will never forget my first delivery with a GDM mama, and the blood sugar was 15, and I was of the baby. Sorry,
I was like, dang.
and I was like, oh my gosh, and then I kept
But
seeing this
50 is not bad.
trend
50 is
of like,
over.
look,
Oh,
15,
15.
15,
I thought
one
you said
five.
50. I'm like, what do you mean? That's past it. That's great.
No. No, yeah,
15.
no,
Okay.
no.
Okay.
One
Okay.
five. Sorry, 1 5.
You're like, hello, baby.
So
There's a margin of
yes,
error on those
um,
machines. I swear that,
yeah,
and they told me the
yeah.
margin error was like 30. I was like, what? That's no, 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 no. But so I also look
Yeah,
at how is the baby looking too at 15, but it's
I know.
alarming and we do things. Okay, go on, go on. Sorry.
Yeah, no, it's okay. So yeah, and being exposed to babies, it was a little scary because babies can't talk. So our job as a nurse, we have to assess the baby, make sure the baby is, like you said, not lethargic, not sleepy, and not jittery, which means it's shaking. And sometimes they might be even blue if their blood sugar is low, like that. And that's really, we have so many things going on after birth. We're making sure mom is fine and the baby is fine. And so we usually do check the sugar 1 hour after baby's born, but in this case, this baby was jittery right away, so I did the blood sugar sooner. It was 15, and I took it again to make sure, but I had a feeling it was still low. And then I had to run to NICU to give
Take
this
her.
baby to them because,
Please.
yes, I want to make sure this
Yeah.
baby's fine.
So
Yeah,
what,
so
but what
that's
is the
why
process?
we are
Why do babies have, why are we checking blood sugars? Why are their sugars so low at birth?
right. So that's exactly what I wanted to
Cool.
talk about right now. So I didn't know why that happened. I just thought all GDM mamas have that, all the babies from GDM mamas, blood sugars are low. And then I realized, and I read more as a labor and delivery nurse, I read a lot of stuff about that. And it explained how if the mother's blood sugars are high during the pregnancy, the baby has to compensate by increasing their own insulin. So if your blood sugars are always on the higher end, the baby's insulin levels are always on the higher end, right? When the baby's born, you cut the umbilical cord, the connection to the mother is not there anymore,
I.e. the
and
sugar.
the baby's yeah, exactly, the sugar, and the baby's insulin is still high, and that's why the blood sugar drops
And it takes
because
so
there's no
much
more
energy to
sugar.
be born, to breathe, to take
Mhm.
that first breath and cry, and it's the fear or whatever they're going through. They're going to use up all that sugar
Yeah.
so fast, right?
Yeah. Yeah, and sugar, even in an adult, affects them neurologically, meaning your entire mental status can be affected. Sometimes people will come to the ER and they think they're having a stroke, but really their blood sugar is low. So it really is something that can happen really fast. You have to catch it right away and you have to treat it right away. In an adult, they can talk, or lack of talking is an indication that they can't respond, right? But with a baby, they're so small and their blood sugar dropping affects them so fast. So that's why we're concerned because it can affect them, their breathing. They can,
If
a
they don't
lot
have
of them turn
energy
blue if
and they
they
don't have
their blood.
sugar to
Yeah,
help them breathe, and their brain,
yeah,
our brains use glucose, and they don't
exactly.
have that, and they need they need to breathe, and they need their brain more than ever right at birth to get through that.
Right, right. And this is not to scare you. This is just to help you understand why we are so concerned about blood sugars for you and your baby. It's to prevent these complications because as a labor and delivery nurse, I was running around trying to, you know, get this baby sugars up, and it really was something that could have been
Yeah.
prevented,
Yep.
honestly. You know, if we really spent more time on prenatal care and more time on education, this risk of low blood sugar can really, really decrease. A second thing is that we didn't have the glucose gel in my first job, so I think that contributed to that. With my second job in labor and delivery in a different organization, when I was introduced to the glucose gel, I'm like, oh my gosh, this is amazing because it'll give the baby, it's kind of like a gel of sugar. And what I was saying before, let me just
Sorry, I probably
backtrack.
interrupted.
What I was saying before, no, you're good. I want to just piece it together for everyone. So when the baby's born, if the baby's pink and responding and crying and, you know, breathing well, we'll put the baby on your chest for skin to skin, and then we'll check your baby's blood sugar after 1 hour, right? We will not interrupt skin to skin for that hour. After the 1 hour, if we check it, and in the meantime, we help you latch
Try to
so
get
that the
sugar
baby
in.
can start
Yeah.
getting
Try to feed them.
colostrum. Yeah. Yeah. So then after 1 hour, when we check the blood sugar and it's low, we're giving the baby colostrum, but we'll give the baby the glucose gel, let's say if it's low, and that'll help the baby not have the sugar drop really, really fast, right? So it's going to help them, and then we can help the baby latch again, and that should help the baby prevent low blood sugars, which was an awesome thing that I really, really loved, and it was effective. We don't just check blood sugars for moms who have gestational diabetes. We also check blood sugars for small babies, for large babies. We have a bunch of protocols that we go by.
We hate
So
it,
this
by the
is in
way.
general. This,
I do not like poking babies,
yeah,
and so
yes,
so I'm
yes,
sorry, but it's just it's
yes,
one little drop. We can usually warm the heel first with a little
yes.
pad, a little warming heating pad, especially for their little heel, and and to help blood flow because their little feet are so cold, or they don't have a really good, not cold, but they don't have good blood flow down
Yeah,
there, so we need to heat it up. And I think squeezing hurts more than the actual poke, so we don't want to squeeze too hard. But I learned some tricks
right,
and techniques from
exactly.
some NICU nurses, but we don't like it. But I hope we've gotten across why it's so important, right? Especially in those first couple of days, the first 24 hours, while you're trying to get the feedings scheduled and in order, and or just getting the baby fed enough that they need.
Mhm.
If you're trying to figure out
Yeah.
breastfeeding or formula feeding or whatnot, it's a process. So that's why we have to check those little baby heel pokes.
Yeah. Yeah, it's for the well-being of the
Yeah.
baby, you know, and we want to make sure also it can, if the baby's blood sugars are low, one more thing to add is that it can cause high bilirubin as
I didn't know
well.
that.
So we,
Crazy.
mhm.
I wonder why. I'm
Yeah.
gonna have to look that up now. I'm gonna look. I swear every episode I learned something I didn't know. It's so cool.
Yeah, I actually learned that from
Yeah,
experience.
like your baby.
No, from working as a nurse in the nursery. Usually, if the baby's blood sugars are low, they're not eating enough also because they're lethargic.
Of
And
course,
that's why
I'm
also
gonna
the
pass enough.
bilirubin.
Okay, that makes sense. That's so much goes
Yeah.
in, like one thing affects another thing. And then also later on in life, if you do you did you read anything about gestational diabetics that the babies have a higher incidence of obesity
Mhm. Yeah.
and
Yeah.
diabetes as well? So maybe that's
Yes. Yes.
because they're already predisposed from life factors, or
Mhm. To a lot of sugar.
yeah, and so
Mhm.
maybe that's why. There's a lot to look at.
Mhm.
Wow, this is so great. This was such a good conversation about just why we
Yeah.
care. Why are we doing this to you? Why are we making you drink this and diagnosing you? We do care so much,
Yeah.
and there is reason these protocols are put into place. And
To keep you and your baby
yeah, and
healthy.
I think if anything to take away is just educate yourself, right?
Mhm.
And trust your body, learn what your body is doing so that you can be aware of signs of what high blood pressure could look and feel like, what low blood sugar or high blood
Mhm.
sugar could look and feel like, right? Even if you have not been diagnosed, it's something to be aware of,
Yep.
right? Because
Yeah,
you can get
because
it.
it can happen at any point, even your fourth
Yeah.
pregnancy or to your sister or to
Yeah.
your friend, and you can, be that support for
Yeah, and
them
it doesn't
too.
have to be a scary thing. I know we just talked about a bunch of scary stuff, but with
I
the first
know.
thing we said before I push record is it's education, right? It's when you're educated,
Yeah,
your fear can go down, the anxiety can go down, which is what we do. So,
yeah. And we're here to educate you about
yes, we
everything,
are.
the
Yes, we are.
good.
Where can we find you? Because if they want a coach that, if let's say they got diagnosed with gestational diabetes and they're like,
Mhm.
that was a great episode, but what? Now it's me? Like, I need to go talk to Sara right now. Where can they find you?
So I'm mostly on Instagram. My handle is Gestational Diabetes Nurse. I do have an awesome weekly email list that I send tips and tricks on. And then I do have a blog as well, a weekly blog. So you can check that out. It's all in my bio. And I have a lot of free resources. I have bedtime snacks for GDM mamas, what you should know for GDM mamas. I do post a lot of tips. And I do have a membership for gestational diabetes mamas, which I'm so excited about because it's really giving you more support. We have Zoom calls, we talk about your food logs, and we go over everything you need to know, NSTs, non-stress tests, BPPs, and I do also help with childbirth prep. So I do have those classes as
Stop.
well. So
Oh
you
my
can
gosh.
definitely.
Just stop Googling right now. Go find Sara. Get onto her membership and you're gonna feel so much better. I have a huge feeling. And you're gonna get birth up too. And then you can work with me too. And then we can all be like a little trio and it'll be amazing.
Yeah,
I'll prep you for the other
exactly.
stuff. The C-section induction. Oh my God, Sara, this was so fun. And I just appreciate you coming on. I
Yeah.
know we had to reschedule a few times. So thank you. Two moms.
Thank
We made it
you.
work.
Thank you so much. This was so much fun.
I hope you enjoyed this episode as much as I enjoyed talking with Sara. We get along so well. It's always fun to speak with a labor and delivery nurse. And yeah, today was no exception. I learned something too. Elevated bilirubin, I didn't even consider it. You guys, there's so many things that are intertwined with our bodies, how one thing affects another. And I guess it's common sense. You should know that. But to put words to it, yeah, elevated bilirubin with gestational diabetes is a risk. Why? Well, if your baby's really sleepy and tired because the blood sugars are low and they don't have the energy and they're not eating as much, then a lot of things can happen, right? The everything kind of slows down with the baby's GI system. They're not going to be pooping as much. If they're not pooping as much, they're not getting rid of that extra blood that is going to then cause elevated bilirubin, because we get rid of our bilirubin through stools. So duh. Oh my gosh. So, I mean, this is why you have to keep learning. This is why I keep speaking with other nurses, doctors, doulas. Everyone can teach you something new. I swear I learn something new every day. And it was just really great to speak with Sara. And I hope I have her back on again soon. And I hope you enjoyed this episode. And I will see you again soon. Go to myfriendsnurse.com. I'm revamping the website. So join me, schedule your call so we can have a little chat. 30 minutes, an hour? Let's talk about your pregnancy. Let's talk about your mindset. Where are you at? How do you see your birth going? What do you need? What questions are you concerned about that you're asking your doctor? Or let's just introduce ourselves and see if maybe we're a right fit. Maybe you're family planning and you're not pregnant yet, but you want to chat and see what you can do to make sure that the pregnancy is as healthy and safe as possible and set you up for success, especially with birth and then even postpartum, right? So go to myfriendsnurse.com. I'm really excited about the website. And if you see any weird things with it, can you just let me know? Go to my Instagram at myfriendsnurse and send me a DM. If you're like, girl, that link is a mess. I'm learning this tech stuff. I'm a nurse. This is not my specialty. My specialty is birth, newborns, pregnancy. So bear with me, but I'm excited. So go check it out. All right. Until next time. Bye. Thank you for listening to My Friends the Nurse presents The Birth Link with Nurse Colette. We hope you enjoyed today's episode and found it super valuable. Before we go, a quick reminder, the information shared on this podcast is for educational purposes only and should not be considered medical advice. Always consult with your healthcare provider for any medical concerns or questions. If you enjoyed the episode, please leave a review, and share it with your friends. Your support means so much and helps us reach more people and continue to bring you great content. Until next time, guys, stay healthy and stay informed.